Hello guys, welcome to Med10. So in this video we will be watching about the management of status epilepticus. Okay, so what is status epilepticus? Status epilepticus is characterized by recurrent attacks of tonic-clonic seizures without recovery of consciousness in between or a single episode that lasts more than 30 seconds. So understanding the meaning of status epilepticus is very important. You need to understand it. It is characterized by a recurrent attacks of tonic-clonic seizures without recovery of consciousness, because there is no consciousness between the seizures, so it occurs continuously in between, or there is a single episode which lasts longer than the 30 minutes. So if you are having a seizure which is lasting more than 30 minutes, then it is called a status epilepticus. So it's a medical emergency and it should be treated accordingly and immediately. So understand that status epilepticus is a medical emergency. Now let's look at the treatment modality of status epilepticus. Okay, the first thing that you need to do is, if there is a patient with status epilepticus, that is if they are having seizures from the past 30 minutes or so, immediately take them to a hospital. So you need to understand, you need to hospitalize the patient right away. So after hospitalizing, first thing that they will do is they'll maintain the airway as well as establish a proper IV line. So maintain the airway of the patient, because sometimes it might also get disturbed, and also establish a proper IV line, intravenous line. Afterwards, after maintaining the airway, you have to administer oxygen to the patient. Administer the oxygen. Then followingly, you will collect blood for estimation of glucose. Is it a metabolic problem? Estimation of calcium, electrolytes and urea as well. Okay. Then finally, through the IV line, you will maintain fluid and electrolyte balance. Okay. So this is what you need to do. Understand it. First, you will hospitalize the patient, and followingly, you will maintain airway and establish a proper IV line. Following which you will administer oxygen and collect blood for estimation of glucose, calcium, electrolytes and urea. Followingly, the fifth day, you will maintain fluid and electrolyte balance. So what are the drugs you give in the case of status epilepticus? Okay. From the step 1, you will give them lorazepam 0.1 mg per kg IV, slow IV you should give, or if lorazepam is not available, you can give diazepam 10 mg, that is also IV slowly. And also you should repeat this after 10 minutes if necessary. If still the seizures are not stopping, then you might repeat this after 10 minutes. Understand it? Lorazepam 0.1 mg per kg of the patient, IV slow, or if lorazepam is not available, move on to diazepam 10 mg IV slow, and you have to repeat this after 10 minutes if the seizures are not stopping. Okay, then in this case, when you are giving these two drugs, make sure that you are watching out for hypotension as well as respiratory depression. So you should also maintain that the airway is all right, and there is no particular respiratory depression. Also watch out for hypotension of the patient. And if these drugs are not working, you will move on to fosphenytoin. You can give fosphenytoin 20 mg per kg IV again in normal saline or glucose, as you have injected already the IV line. So make sure you give fosphenytoin 20 mg per kg IV in normal saline or glucose. Or if fosphenytoin is not available, you can also give phenytoin 20 mg per kg IV infusion, or else as 50 mg per as in IV infusion, you should administer it as 50 mg per minute in the normal saline. So understand it. Next, what will give? We'll give fosphenytoin 20 mg per kg IV in normal saline or glucose. You can give fosphenytoin in glucose as well. That is the main difference of it. Okay, then you can also give phenytoin, which is 20 mg per kg IV infusion, or 50 mg per minute in the normal saline. And in this case, you make sure that you are monitoring the cardiac rhythm as well as BP of the patient. And if the seizure is still continuing, this is very important. If the seizure is still continuing, move on to the step 2, that is phenobarbital. Alright, you are giving phenobarbital 10 to 15 mg per kg of the patient, again in the IV infusion at 100 mg per minute. So this is important. You have, after moving on to the step 2, you are going to give phenobarbital 10 to 15 mg per kg IV infusion 100 mg per minute. So again, you should watch out for the respiratory depression. Okay, and if the seizures are still continuing, followingly you will go for the step 3, that is the general anesthesia with IV midazolam or propofol. Understand it? If the seizure is still continuing, make sure you move on to the step 3 by giving them general anesthesia with IV midazolam or propofol. And when you are giving general anesthesia, make sure that you are maintaining the airway and BP of the patient. This is very important. You often forget to maintain the airway and blood pressure. So maintain the airway and blood pressure while giving the general anesthesia with proper IV metazolam or propofol. So finally, ending this beautiful lecture with thought for the day, that is, you can never expect to succeed if you only put in the work on the days you feel like it. So understand, you can never expect to succeed if you only put in the work on the days you feel like it. Okay, thank you for watching, guys. Stay happy and keep learning. Bye. And also, you should help someone by sharing this video if it is necessary. Okay, bye guys, bye, and I'll see you soon.